Your pearly whites, your chompers. Teeth have been given a lot of nicknames over the years, but no matter what you call them, there's no denying their importance, right? Teeth are also an important barometer of our health, and so not taking care of them could cost you down the road. Dr. Peter Blanchard, DDS, says education is critically important to helping your teeth last a lifetime. He joins us this morning with more. Good morning to you, Doctor.
Good morning, Danielle. Thanks so much for having me on the show.
I'm glad you are here. It's an important issue. I want to jump right into it. Why is oral health so important?
Oral health has been linked recently with a lot of systemic health conditions, such as diabetes. We have a chronic infection often going on in the oral cavity, which can cause, exacerbate diabetes. It can cause arterial disease. Not to mention pain and suffering.
I was going to say the pain and suffering, but the other things like diabetes, I don't know that people necessarily think of that being possibly caused by not taking care of your oral health.
It has a tremendous impact on the body's health.
Isn't that something?
If we don't take care.
So let's talk about tooth decay. What puts a person at risk?
There are a number of risk factors for tooth decay, and we try to sit with patients and identify these risk factors and help them eliminate them from their lives so that they can have better oral health.
So when we talk about risk factors, is it what we're eating? Is it what we're drinking? Is it not flossing? Is it all of the above?
It's important to understand that there are both risk factors and protective factors.
Okay.
So if we eat a lot of candy, if we have a lot of acidic sports drinks, those can damage the teeth very readily. But protective factors such as fluoride and public water supplies really help us to take better care of our teeth.
All right, so let's talk about kind of the older population. By older, I mean teenagers, and because when I think about good oral health, right, I'm thinking about my little 5-year-old, but it's really kind of the adult issue that people aren't addressing, right, doctor?
Well, I can't overemphasize the importance of great oral health for kids. This is when we develop the proper habits to maintain health throughout life, and also it creates a healthy environment in the mouth at that age. As we grow up, we're assaulted with more and more risk factors.
We are assaulted with all that sugary stuff.
And the sports drinks, the very acidic sports drinks can demineralize the teeth, causing cavities. So it's really more about identifying these risk factors with growing kids and teenagers, especially teenagers, and helping them to control the risk factors and to work with the dental team to get better oral health. But if we can partner with patients and set up a plan for better oral health, then they can take control of it themselves.
So is there something I should be looking for in the ingredients on the back of my toothpaste that can maybe help me take better care of my oral health?
The first ingredient we should look for is right in the kitchen under the faucet to make sure we have fluoride in our public water supplies. It's so important, especially for the growing kids. The second thing that I recommend for my patients, if they are at risk for disease, is a prescription strength fluoride toothpaste. We prescribe ClinPro, which is made by the 3M company. And that can actually help to remineralize the teeth. You can heal cavities if you catch them early enough. And using the right prescription therapies, we can actually drive the process backwards so the tooth heals itself.
Very interesting. So, doctor, let's leave our viewers with something to chew on. What is the message or the takeaway here?
I think the most important message, Danielle, is that gum disease and cavities are 100% preventable. We don't have to go through the pain and suffering of drilling and filling and infections. If we identify the proper risk factors and work with patients to control those risk factors, then we can eliminate this disease altogether.
I love that, so I'm glad I partnered with you this morning.
This is very fun.
Very fun for me as well. Good to meet you.
Thank you very much,
Danielle. I'm going to go home with
Danielle.
right now. And for more information on oral health care, please visit the folks at 3mespe.com. It's 3mespe.com/preventive care.